Hi there, my name is Cassandra Sampson, and I am the registered dietitian that works with the patients of Dr. Bass. And if you're listening to this class right now, you are probably right around the corner from your surgery, or you're getting very close to your surgery, which is very exciting. This is going to be the fourth lifestyle class. So we're going to talk about lots of things that you've probably heard before, maybe some things you haven't heard before, but hearing it more and more and more is just going to be helpful for you. So on this slide right here, make sure that you have my phone number. This is actually my cell phone number. So make sure you have that, save it in your phone, make sure that you have my website available and also my email address, because these are going to be the three easiest ways to get a hold of me. All right. So these are the things that we're going to talk about today in our fourth lifestyle class. All of the materials that you need from me are actually on my website at all times. So if you go to cassandragolden.com, if you click on the first yellow button, it'll say bariatric surgery patients, click here. And then one of the buttons after that is going to say download your nutrition resource guide. So that is something that you probably got from me in one of the one-on-one appointments that we probably had prior to this class. If you haven't had a one-on-one with me prior to this class, you can always get the nutrition resource guide right from my website. So this presentation here that I'm about to go through is really based on that nutrition resource guide. There is some extra goodies added in to this presentation that's not in the guide, but for the most part, you want to make sure that you have that guide available to you. All right, so you've probably heard this before, that this journey requires a lifestyle change. We're not just, gonna speed our way through getting the surgery and then we're just gonna get to, your weight loss goal and then we're gonna throw everything out the window. Okay, this is gonna be a full-on lifestyle change. And that's why the process to get to surgery usually takes a while. It's not like an overnight situation, and it's usually not even like a month. I've seen 6 months to a year be like on average what people typically take, the amount of time that people typically take to prepare for something like this. So the goals and the guidelines that we recommend prior to surgery, it's really to set yourself up for success, and it's really to help minimize weight loss plateaus in the future. And it's also to minimize any post-op complications as well. So for example, one of the things that we require is a 7-day pre-op liquid diet. So that liquid diet is not optional. It's in place to help with safety and effectiveness for the surgery. So that's just one example of the goals and guidelines that we have in place. There's all a big reason for it. There's a method to all of the madness. All right. So the mindset, I would say, is the biggest part of this journey. Yes, we have to make changes to our habits and our lifestyle, but all of that is going to be influenced by what's happening up here in our mindset. So this surgery is a tool that is only as effective as you allow it to be. Okay, and that all starts with our mindset. All right. So the decision after surgery is still in your hands. So the surgery can't decide what food you're going to eat. The surgery can't make you exercise. The surgery can't make you prioritize the time needed to grocery shop and meal prep and drink your water and all of the things that are going to be so important to set yourself up for success after surgery. So the surgery can't make you do these things, right? It's going to take discipline and motivation and commitment, and all of these decisions are still up to you to make to be successful. All right. So the decision of what to eat, when to stop eating, how to eat. And what I mean by that is your pace of eating, whether we take big bites, small gulps, separate drinking from eating, all of that is up to you to make those changes, right? The surgery can't make you do those things. Now, the surgery can cause a consequence on the other side of that. For example, if you take too big of bites, it could be painful. If you don't pay attention to your fullness and you overeat even 1 or 2 bites too much, you can feel sick. So, the surgery does play a big role in helping those decisions, especially when people kind of learn the hard way. But the decision is still going to be in your hands after surgery. So it is important to commit to healthy lifestyle habits for the rest of your life to be successful with this procedure. All right, so here are the primary goals that you've probably heard already up until this point. But these goals will pretty much relate to everybody. After I go through the primary goals, I'll go through briefly just some other additional goals that might not relate to everybody. So we're going to talk about making a plan. We're going to talk about physical activity, why that's important, portion sizes, mindful eating strategies, and then some other additional goals. So let's talk about making a plan. So I think any goal that we have really in life, it starts with a plan, right? We don't just all of a sudden reach our goal without figuring out how we're going to get there before we actually get there. So your plan, as far as this journey goes, is a diet plan, right? So our diet plan should consist of high protein and then carbohydrate conscious. So when I say the diet plan needs to be conscious in carbohydrates, what I mean is the type of carbohydrates, we need to pay attention to that, and obviously the amount of carbohydrates. So there are healthier carbs, and then there are less healthy carbs. So the healthier carbs would be like fruits, vegetables, whole grains, beans, peas, legumes, lentils, things like that. And then there are the less healthy carbohydrates. These would be refined carbs. These would be like processed, like junk foods and sweets and things with added sugars and white flour and things like that. So when we're thinking about our plan for our diet, we need to have high protein, and that's lean proteins. So lean proteins would be like any type of grilled meat or grilled fish. We don't want it to be fried, but any type of grilled lean meats. It could be eggs, it could be low fat, low sugar dairy, it could be beans, it could be nuts. So we want to have a high protein diet and then carbohydrate conscious. So you've probably heard this before, of course, you're going to hear it a million times. We need at least 80 grams of protein a day, and I'll tell you why that's important in just a second. I just mentioned we need to limit the refined carbohydrates. That's like what people would consider like junk foods or processed foods or any type of food that has a low protein amount and then a low fiber amount. Typically, like processed foods or refined carbs can also be high in sodium, and they could also be high in added sugar. All right, so we do recommend 3 portion controlled meals during the day, starting with breakfast to minimize any grazing or snacking. So this might feel odd in the beginning, right? Because many patients that I work with typically don't eat breakfast and then they don't really have a planned out lunch. Maybe it's a snack, maybe it's not, maybe they just have coffee, maybe they just have like an energy drink or something like that. And then at night, it's where everything kind of falls apart. So at night, it could be then I overeat at night, or I binge at night, or I have cravings at night, or I eat right before bed. And to prevent that whole cycle from happening, we really need to make sure that we eat more consistently during the day and nourish your body during the day so that we're not having that result in the evening. Okay, so we don't want to skip meals. Now, if you're doing something like fasting, that's a little bit different. I mean, you might be skipping meals, but you're still hopefully nourishing your body appropriately during your eating window. I will say though that after surgery, you may not be able to do intermittent fasting, just because if you go too long without eating, your blood sugar can drop, and there can be some hypoglycemic events that could be um, undesirable, but it could also be concerning as well. All right, so prior to surgery, we do want to aim for 25 grams of fiber or more. I say before surgery because after surgery, you are going to have a limited amount of space in your small stomach, whether you have the sleeve or the bypass. So it's going to be hard to get up to 25 grams of fiber, especially in the very beginning. In the very beginning, the priority is protein. 80 grams of protein is always going to be in the front of your mind. Eventually, you will be able to add in some high fiber sources from fruits and vegetables and whole grains. But in the beginning, it's going to be challenging and it's going to be expected that you're going to have a low carbohydrate diet in the beginning. But before surgery, while you still are having adequate amounts of carbohydrates and while you still have, your full stomach, this is where we can add in some fiber prior to surgery. Okay. So protein, protein, protein. You're going to hear it a million times. And protein is the priority for many reasons. So you may be thinking, I keep hearing about protein, but what can I eat that has protein in it besides meat? Maybe you're not a meat eater, maybe you are. Either way, there's a lot of other options other than meat. We can go with eggs, we can go with beans or lentils or peas or chickpeas, something like that. We can go with fat-free, low sugar yogurt or even low-fat cottage cheese. Any type of low-fat dairy is going to give you some protein. For example, low-fat string cheese or even like the Babybel cheese. And then if we wanted to do some vegetarian options, edamame, great source of protein, tofu and tempeh if you want to step outside the box. I can help you with some ideas with those two things because that's kind of a staple in our household. And you may be thinking, okay, I'm trying to keep track of how many grams of protein I'm eating a day, but what if what I'm eating doesn't have a food label? Maybe I got it from, my family member's house, and obviously there's no food label. If you know the ounces that you're consuming, then you'll be able to know the grams of protein. So 1 ounce of chicken, turkey, fish, beef, or pork, so basically any type of meat or fish, 1 ounce is equal to 7 grams of protein. So if you have 4 ounces, which is typically usually like the size of your palm, like 3 to 4 ounces, you'll be getting about 28 grams of protein for that, which is awesome. Now, if you had eggs or anything else that's listed on this slide, there will be a food label. The exception would be if you're getting eggs from like a real life chicken, then there wouldn't be a food label. But 1 egg is about 7 grams of protein. Okay. And again, if I'm going too fast with these slides, you can always get this presentation from Dr. Bass's website. If you click on patient forms, it's listed on there in the list of patient forms. And then also on my website, which is CassandraGolden.com. If you click on bariatric surgery patients, click here. The resource guide will also be on there. Okay. So why is protein so important? We need it for healing. Number one, we need it for healing. So any type of surgery that you're having, whether it's on your stomach, whether it's on your knee, whether it's on your, elbow, you're always going to need healing after surgery, and that's where protein comes in. Protein also helps supporting your muscle maintenance. So especially after surgery like bariatric surgery, you're going to be losing weight very quickly, woohoo, after surgery. However, we want to make sure that you're losing body fat and not muscle mass. So having adequate amounts of protein can help you preserve that lean muscle mass. And also what helps with that is doing strength training. Strength training is going to help build lean muscle mass. So when you're approved to do something like strength training activity after surgery, after Dr. Bass says it's okay, you definitely don't want to forget about the strength training. I think most people go for walking first and then doing cardio, but we can't forget about the benefits of strength training. Protein also helps you feel more full after surgery. Eventually, when your hunger signals come back, protein is going to be very important for that. And then protein also helps stabilize your blood sugar. It's never too soon to start working on getting to that goal of 80 grams of protein a day. So if you haven't had the surgery yet, which if you're in this class, you probably haven't, it's never too soon to start striving for that goal. I think it's important to try to meet that goal before surgery so that you know what it takes and you know what your go-to protein options are going to be. So here are just a few visuals of what 60 to 80 grams of protein looks like. And the reason why I think it's important for me to show you this visually is once you hit the regular diet, so these pictures here, it's obviously not the liquid diet. This is an example of the regular diet after you have the surgery. Once you hit the regular diet, you can still have versatile, creative, delicious meals, and they can be colorful, different textures, different temperatures. They're satisfying. So I don't want you to think that you're going to go into surgery and then afterwards you're just going to live off of protein shakes and then eventually broccoli and chicken, because you can do that if you want to, but this will be a lot more satisfying and a lot more exciting. So here's another example for you, how to eat 80 grams of protein a day after surgery. And just know that immediately after surgery, you're not going to get to this goal of 80 grams of protein, and that's okay. It's going to take time. It's going to take weeks. Typically, I meet with patients 6 weeks after they have their surgery, and by that point, I would say about half of my patients are able to meet that goal, and half of them are still striving to get up to that goal of 80 grams of protein a day. So once you have the surgery, your meals are really going to feel like snacks. I mean, they're going to be the size of like snacks or like mini meals. So here's just some examples for you of some mini meals that are still going to have a good amount of protein. All right, so the first two goals that I just talked about was making a plan and then eating protein. So those are our first two primary goals. Our next goal that we're going to talk about is tracking your intake. I can't tell you how important it is to start keeping track of your intake if you have not already done so. And it's so easy. There's a free app, and you can also use it you can use it on your laptop if you would rather do like a website rather than the app. But either way, it's free and it's easy to use. And tracking your intake brings awareness to what you're eating, when you're eating, how much you're eating, why you're eating, and you can really start to gather certain patterns and learn certain things about your eating behaviors. So it's nothing but beneficial. It does take a little time, yes, and it's not something that I would say that you would have to do forever. You don't have to keep track of your intake forever, but especially in the beginning as you are preparing for this journey, and then especially right after you have the surgery, it's important to keep track so we can know how many carbs am I eating, how many calories am I eating, am I getting close to the goal of protein or not? The only way that we're really going to know is by keeping track of it. There's only so long that you can kind of guesstimate and keep track in your head. It's not going to be as accurate as actually writing it down in an app. All right, so keeping track of your intake is one of the habits of highly successful post-op patients. So there's some research that has been done on those patients who have had the surgery and kept their weight off for at least 5 years. So that's what we would consider highly successful post-op patients. And these highly successful post-op patients have a few things in common. Number one, making a plan. Number two, keeping track of their protein and hitting their goal. And number three, keeping track of all of their intake. So these are the numbers that we want to be aware of. 80 grams of protein, 40 to 50 grams of total carbohydrates a day for the first 6 months out from surgery. After 6 months, you will have a little bit more room to have more carbohydrates, but it really depends on your situation. If you're able to exercise, how intense your exercise is. If you're unable to exercise for whatever reason, you may not need that extra in carbohydrates after 6 months after having the surgery. We want 64 ounces of non-sugary fluids, at least half of that coming from pure water. And then also you want to start practicing separating eating from drinking and waiting 30 minutes after a meal to drink again. All right, the next habit of highly successful post-op patients is physical activity, consistent physical activity. It's important to choose an activity that you actually somewhat enjoy. If you are not one that likes to get up before the sun rises and go to a boot camp class and get yelled at, then don't try to do it because it's not going to last very long. It's not going to be a sustainable habit for the rest of your life. So make sure you think about something that you somewhat enjoy because that's what's going to last the longest. Exercise is imperative for weight loss, yes, but there's a lot of other things that exercise is important for. Our mental health, stress relief, our heart health by lowering our blood pressure and our cholesterol and managing our blood glucose. So if you're feeling on the fence about if you feel like exercising, think about all of the other additional benefits that exercising will provide to you beyond just weight loss or weight maintenance. Okay. Portion control, this is a huge one to really pay attention to before surgery and obviously after surgery too. After you have the surgery, you will have a physical restriction to the amount of food that you can eat. But prior to surgery is where we need to get into that mindset change that I mentioned in the very beginning. So the first step to weight loss is becoming more aware of how much you're eating and being intentional about not eating until the feeling of feeling sick or overfull or sluggish, things like that. Because after surgery, you will have that consequence. If you do eat even, one bite too much, you could feel pain, nausea, you could have dumping syndrome, you could have vomiting, and it's not going to help you with your weight loss journey either. So this is really something that you want to start focusing on now. And what can be helpful with portion control is slowing down your pace of eating and eating more mindfully and trying not to multitask while you're eating and taking small bites and chewing very thoroughly. All right, so on this slide, there's just some other strategies as far as managing your portion sizes, like using a smaller plate or a smaller bowl, putting less food in front of you just to begin with, ordering less food if you're ordering from, a certain place. You want to challenge that clean plate club mentality that maybe we grew up with. Again, eating without distractions, eating more mindfully is so important with portion control. And then also creating intentional stopping points throughout your meal to assess your hunger and assess your fullness level can be greatly, greatly beneficial for you. And then finally, avoiding eating straight from like the bag or the box or the container or the jar. Typically, these are more like snack foods, which can be a little bit of a dangerous thing, especially if we're trying to lose weight. But if you do have some sort of a snack food, try not to eat directly out of the container, and instead grab a handful of whatever it is, put it into a smaller bowl, or like a smaller bag, and then eat from it more mindfully and really savor it and concentrate on what it tastes like and all of that. And that's going to help control your portion sizes, especially if you're having a snack. Speaking of mindful eating, how many of us can say that we slip into mindless eating or eating on autopilot very easily? If we have kind of grown up this way, or maybe our career has kind of turned us that way, if we're going to eat, we have to eat and work at the same time. It makes it very hard to just focus on eating if we have kind of been primed to multitask when we're eating. So I challenge you to try to turn off as many distractions as you can when it's time to eat. I know that if you have a toddler like I do, or you have an infant like I do, we can't just turn them off when it's time for us to eat. And I get that, but we can do the best that we can with just trying to focus on each bite and chewing thoroughly and eating slowly and paying attention to what our body is telling us about hunger and fullness. Okay, so after you have the surgery, the sensation of being full is probably going to feel different. Some patients have described this feeling as a feeling of pressure in their upper stomach area. Other patients have described it as just a very hard stopping point. I've had other patients describe it as they start to get the hiccups, or their nose starts running, or they start to sneeze. Typically, if we're having that type of reaction, it means that we ate just a little bit too much. So you really don't want to get to that point, but just know if you do get to that point, you're done. That's the point of stopping. All right, so mindful eating is all about being aware of all the aspects of eating. This is, what does it taste like? How fast am I eating? What is my environment right now? Is my environment helping me slow down eating, or is my environment really leading me to eating on autopilot? All right, so these are the other goals that I had mentioned. They may not relate to absolutely everybody. For example, eliminating sugary drinks. If you've never been like a sugary drinker, that is awesome. But there's other people out there that this is a big one for them. So maybe we need to set one or more of these goals right now, if we haven't already, because these are very, very pivotal goals that will be very important for our success. All right. So many people ask about, why do we have to cut out caffeine? The reason why is cutting out caffeine can help reduce the risk of an ulcer while your stomach heals. Caffeine is an irritant by nature. So if we introduce an irritant into a very sensitive stomach, it can be painful. Um, it can also increase the risk of an ulcer. It can increase the risk of acid reflux. Um, so we want to wait at least a month after you have the surgery to even think about bringing back caffeine. We also want to make sure that you wait until you're meeting your hydration goal of 64 ounces before you reintroduce caffeine. Then you need to think about, how am I going to reintroduce the caffeine? Is it going to be in coffee, which typically it is, because we definitely don't want to bring soda back. But if it's in coffee, you need to think about the added sugar component. What am I going to do if I need it to be sweeter? Which after surgery, typically patients say that sweet things are just like overly sweet after surgery, so you may not even have to put any sugar in there. But instead of regular sugar, let's think about monk fruit, or let's think about stevia instead, or let's think about a little dash of honey. And then if you typically do creamer, let's think about cleaning up the creamer, doing less creamer, a different brand. All of those things are important. And it may not seem like a big deal in the grand scheme of things, but once you have the surgery, from 0 to 6 months out from surgery, you're only going to be having about 600 to 800 calories a day. So if you're typically going to Starbucks and you're getting, just like, I don't know, like a big old Frappuccino, that could be 300 calories right there, if not more. That could be half of your calories for the whole day. And we don't want half of our calories to be coming from something that's not giving you protein or nutrients, and it's just giving us a lot of extra calories and a lot of extra added sugar. Okay, by this point, if you're in this class, you already probably know that weight gain is definitely a red flag during this process. If your weight has fluctuated a little bit up and down, that's completely normal with digestion and hormones and things like that. But if you have significantly gained weight from the beginning of this journey, just know that that's going to be a red flag and you're probably going to get asked about it. Our goal is to really start losing weight before you even have the surgery. All right, so this is your getting ready checklist. So if your surgery is around the corner, you want to make sure you have all of these things on deck, okay? Make sure that you have these things available to you, if you have the means to get them, of course. Not everybody has to get a food tracker, but if you want to, make sure that you have it and it's ready to go before you hit the full liquid diet, so it's one less thing that you have to worry about. Okay, there's some books that I recommend. Now, if you decide to go for the intuitive eating journal that I wrote, I actually designed that journal for those who are either very pre-op or very post-op. So that intuitive eating journal, it really helps you get out of like the chronic dieting mentality. But it's not a journal that I would recommend for someone who just had surgery, or you're on the liquid diet, or you're just entering the regular diet. I would either recommend like way pre-op before surgery, or at least 6 months after surgery. And there's reasons why. And if you do look into the journal, it's on Amazon. You might realize why I have that recommendation, because there is some experiments that I recommend that people go through in order to heal their relationship with food after being on like many diets and their weight going up and down with weight cycling and things like that. So just kind of keep that in mind. All right, so let's start our countdown. So if you are 30 days out from surgery, so a month from now, you're having the surgery and your life is about to change and it's going to be so great. You want to start taking your bariatric supplements 30 days before surgery. This includes your bariatric multivitamin and then your separate calcium supplement. I'll talk about that in more detail in just a second. By this point, hopefully you're in the habit of tracking your intake on Baritastic, and then also start one meal replacement with a protein shake, unless you've already started that. 14 days before surgery, so 2 weeks before you're having the surgery, we stop all appetite suppressants. You start replacing 2 meals a day with a protein shake, and then you'll have 1 low-carb meal. Protein shake requirements. Now we do recommend either Premier Protein, Fairlife Protein, OWYN, which is OWYN, Aloha, or Evolve. Those are all brands of protein shakes. The last three that I mentioned are dairy free. They do have some fiber, which is why I love them, but they do have less protein overall than like Fairlife or Premier Protein. But if you're getting more protein elsewhere in your diet for the day, then there still is room for having something like a dairy-free protein shake. So make sure that you read the nutrition label for whatever protein shake you decide on, because I know some people have their favorites. Some people just have some leftover shakes from other diets or whatever. But some protein shakes are designed and intended for people to gain weight. So we have to make sure that we're not taking a protein shake that has 350 calories and 40 grams of carbs and, countless amounts of sugar, because that's not going to help with this process that we're trying to do here. All right. So if you're interested in getting OWYN, OWYN is the dairy free. I do have a discount code for 20% off if you want to order it from their website. Of course, if you find it in the store, you could use this promo code, but if you wanted to just try it out on their website, there's the promo code at the bottom. All right, you can also make your own protein shake. That's obviously always an option. Now, like I said before, once patients have the surgery, a lot of times the protein shakes are just very, very sweet after you have the surgery. So making your own protein shake can really be the solution to still getting a good amount of protein, but not with all the extra sweetness. All right. So don't add fruit, especially when you're on the full liquid diet leading up to surgery and then the full liquid diet 2 weeks after surgery. We don't want to add fruit because it's going to be very important to have as much protein as we can during that time without any of the extra carbohydrates, because those extra carbohydrates are going to take up room in your small stomach pouch, and it's going to be even smaller than usual because you're going to have some swelling after surgery, and it's going to be even harder to get to that protein goal. If you want to add a protein supplement, you can. Constipation is definitely a thing after surgery. So in order to set yourself up for success in that regard, you can add like Metamucil or Benefiber, and you also probably want to have Miralax on hand, just in case you need to get things moving. 7 days before surgery, you start the full liquid diet. This is also when you'll start the daily sugar-free electrolyte replacement drink. That can be something like Gatorade Zero or Propel Zero. Is it Propel Zero? Whatever the sugar-free Propel, Gatorade, Powerade, whatever that is. That's what you'll want during that time. You'll also continue with the sugar-free electrolyte replacement drink for 7 days after surgery. So 7 days before and 7 days after. So you want to make sure that you have those things on hand again so that you don't have to worry about getting them or ordering them online when you're in the liquid diet. All right, so goals for the pre-op diet, these are very loose goals. We say about 1,000 calories, 40 to 50 grams of carbs a day, 80 grams of protein. Everybody's going to be different because everybody's different regarding our age, our gender, our ability to exercise, our mobility in general. So there's a lot of factors that are going to influence how many calories you should have at that time. But just know that the pre-op diet, the goal is to lose weight during those 7 days before surgery. The goal is not to go crazy on drinking as many protein shakes as you can, in one day, but we don't want you to be starving. We don't want you to feel deprived. So obviously when you're hungry, have something, whether it's low sugar yogurt, low fat cottage cheese, soup, blended soup, that is, protein shakes. These are all things that you're allowed to have on the full liquid diet, but we don't want to go above and beyond and just kind of like consume just to consume. So the purpose of the pre-op liquid diet is to help with safety and effectiveness of the surgery by shrinking your liver and reducing abdominal visceral adipose tissue. It's not optional. Okay, So really, once you're on the liquid diet, on the full liquid diet, you're basically only allowed to have what's on this list. Okay. So you have access to this list in the nutrition resource guide, and then it's also on Dr. Bass's office website, which is Gulf Coast Bariatrics, if you click on patient forms. All of the information that you need is always online and available to you. So if you're going to have soup, it has to be strained, so it's just the cream base or it's just the broth, or you can put it through the blender, but we can't have any extra starches in it, which means it can't have noodles in it or rice in it or potatoes in it, nothing like that. So if it has that in it, it needs to be strained out. But if it's just like veggies and say chicken or any other type of meat or something that's low in carbohydrates, you can put it through the blender and have soup. And that'll be a very filling and satisfying soup, but it will be a liquid. So it will be allowed in the full liquid diet. All right. So a lot of people ask me, once they're ready to reintroduce, more options rather than just protein. These are the lowest carbohydrate fruits. But what's so important about this slide, and I can't emphasize this enough, is the portion size. So I don't know if anyone out there loves prunes, but only one prune is 5 carbohydrates. Okay, so we can't have a handful of prunes. Say you're like, oh, I'm constipated, I'm just gonna, eat 12 prunes at once. That's gonna be kind of a disaster in a few ways, but it's gonna be a lot of carbohydrates because one prune is 5 carbohydrates. Okay. So when we're looking at this slide and we're thinking about the lowest carbohydrate fruits, we have to look at the portion size. Have to. All right, and these are the non-starchy vegetables. These are going to be, oops, I don't know how to go back. Sorry, I can't go back. Wait, yes, I can. No, I can't. Okay, so the non-starchy veggies that were on the slide before, again, it's going to be available in the presentation, which is on Dr. Bass's website. But when we talk about non-starchy vegetables, it means that they naturally have a low amount of carbohydrates, which is a good thing. All right. So I mentioned low sugar yogurt. Low sugar yogurt is a great option for a protein source, but we want to just make sure that we're choosing the right brand. Okay, so here are some brands I have listed on the slide here. And there may be others that you've come across, but we want to make sure that there's 13 grams of sugar at the most. I mean, I think most of these are going to be lower in the 13 grams of sugar, but the lower the better, honestly, because we don't need all of that extra added sugar. There's going to be some sugar because it does come from milk, and lactose is a sugar. So there's going to be some sugar, which is fine, but we want to go low on the sugar as possible. All right, so the clear liquid diet begins one day before surgery and lasts for day 1 and 2 after surgery. It's a restrictive diet, yes. It's a short term, also, yes, a short term diet. So you can have water, yay. You can have clear protein drinks, they just can't be red or blue. The clear protein drinks are important during this time because you'll see everything else on this list has no protein in it naturally. So you can add an unflavored protein powder to broth soup if you want to. You can also get a savory flavored protein powder from my website. For example, there is chicken noodle as an option on my website. So you can add that to broth soup so it has protein in it. You can add unflavored protein powder to, well, when you're on the full liquid diet, you can add it to like unsweetened applesauce. But other than that, there really aren't very many options for protein during the clear liquid diet. So that's why the clear protein drinks are going to be so important. And you want to stock up on those prior just because they're not easily found in like real life. You got to typically order them online. Let me see if I have a list. I think I have a list of the clear protein drinks. But here are some recommended brands for unflavored protein powder. And then you can get the chicken soup flavored protein powder from my website. You would click on bariatric surgery patients, click here. Then you would click on buy your vitamins and supplements here. It's another yellow button. There's also the caramel latte protein powder. If you are in that journey of cutting out your coffee, it's a great replacement for coffee because you still get that flavor, but you don't get the caffeine. You can also get clear protein drinks on my website. I believe it's 20 grams per bottle, and the bottle is not huge. I mean, it's not like this size. It's like the size of like a regular water bottle. All right, so here are the brands that you would want to look up. If you don't get it from my website, the other brands that you would want to look up are listed here for the clear protein drinks. Remember, they can't be red or blue. All right, let's get into the vitamins and supplements. So why do we recommend taking your bariatric multivitamin and your separate calcium 30 days before surgery? The reason is it's not common for patients to be deficient in certain vitamins prior to surgery. Namely like vitamin D, sometimes vitamin B12, there we go, sometimes iron. So we want to make sure that we're at adequate levels of nutrients as much as we can prior to diving into this weight loss surgery journey. So this is one of the things that is not optional, and that's because there are life-threatening complications that can occur as a result of not taking your bariatric multivitamin and your separate calcium every single day. I've seen it happen, not often, but I have seen it happen, and it's serious. And most often the situation is that people, start losing weight after surgery. Their energy is up, they're confident, doing all the things, living their life to the fullest, and they're feeling good. And if they're feeling good, they don't feel like they need to take their vitamin or their calcium. And so what I've seen happen is once someone kind of just steps away from that, they don't really think about it again unless they have this conversation with me. If it doesn't really come up, and then down the road, like years down the road, if you start to have certain symptoms, by that point, the vitamin deficiency is pretty severe. Other ways that we kind of prevent that whole thing from happening is having follow-ups with Dr. Bass and getting your blood taken. And, there's steps to help prevent, a major deficiency from happening. Okay. All right. So your required supplements are going to be a chewable adult bariatric multivitamin, not the gummy form. The reason why we don't want to have the gummy form is not because of the added sugar. I mean, typically people just assume it's because of that. But the way that a gummy vitamin is made, it just can't hold the amount of nutrients that you need after bariatric surgery. You would have to take quite a number of gummies to meet the same nutrient amounts as having a chewable rather than a gummy. Okay, you need to take a bariatric multivitamin with iron unless you were already told by like your healthcare provider or Dr. Bass that you don't need to take it with iron, or you already have a separate iron supplement that you're already going to be taking, or maybe you already take iron infusions. Why did I say fusions? Iron infusions. So there's some special exceptions there, but for the most part, we all need to take a bariatric multivitamin that's chewable with iron. We also need to take a separate calcium supplement, and that calcium supplement needs to be separated into 2 different doses, okay? Because whether we have surgery or not, we can only absorb so much calcium in one sitting. So we have to take our calcium in 2 separate doses. So we take your bariatric multivitamin with iron, and then separate from that, you take 1 calcium supplement, and then separate from that, you take your second calcium supplement. Now you can experiment with when you want to take your supplements. I recommend taking your bariatric multivitamin with iron at night and take your calcium either in the morning and then also in the afternoon or somewhere, during the day, separated, of course. All right. If you're having trouble tolerating your vitamins, either before surgery or after surgery, make sure you don't give up. I'm going to give you some strategies to kind of work through, but above all else, don't give up. Message me so that we can talk about it, because giving up could lead to some pretty severe complications down the road. And before I get into that, you can buy them on my website. No surprise there. And this is why I want you to really just become familiar with my website, maybe like bookmark it or save it somewhere special, because you can get a lot of things on my website. There's a lot of resources on there for you. And then you can get your vitamins on there as well. You can also get them from Dr. Bass's office, and then you can get them online. So say you have like some Amazon points that you want to use or whatever. Make sure that you're getting your vitamins from a trusted source. So don't just get any random, like just type in bariatric multivitamin on Amazon. We want to make sure that you're getting it from a trusted source. All of these companies here on this slide, they do research, and they're trusted, and they're backed by research and bariatric dietitians like myself. And also make sure that you're always aware of the serving size for your bariatric multivitamin specifically, because you may just think, oh, I just take it one time a day. But if you look at the instructions, it may say take one supplement 2 times a day or one supplement 3 times a day. That's going to make a big difference. Number one, if you're meeting your nutrient needs, and number two, if you are going to continue taking them that many times a day in the future. So we want to make sure that whichever one we choose is going to be sustainable for us. All right, so here are some of the strategies that we'll talk about if you're having trouble tolerating your vitamins. We can change up the timing. We can break your chewable in half and separate them, because maybe just all of that iron and all of those nutrients all at once may just be making you feel sick, which happens. So we may try that. We may just switch to multiple times a day. We may blend the chewable into a protein shake to kind of mask it in a different flavor. So those are just some of the ideas that we can kind of talk about. Vitamin patches are not recommended due to the lack of proof regarding the effectiveness of the vitamins, of actually being able to absorb those vitamins through our skin. There's lack of research out there to tell us that it's actually going to do something, and they're more expensive. All right, so we might want to take a picture of this slide and have it handy, just because this is the official like post-op diet progression after you have the surgery, starting at day 1 and 2 with the clear liquid diet and going all the way to day 30, which is when you start the regular diet. So here are just some tips for you. Over the years of me being a bariatric dietitian, these are some tips that I have accumulated. So we want to make sure that we're getting lots of fluids. Fluids and protein and your vitamin are the 3 main priorities after surgery. 1/3 of all post-op bariatric emergency room visits within a 3-month period after surgery is because of dehydration. So if you're not a water drinker before surgery, we need to get into the habit of being a water drinker so that after surgery you are also a water drinker. Also, it's very normal not to tolerate textures for the first time once you try them. Once you're back on a regular diet, it's very normal. So don't get discouraged. Don't think that you're never going to be able to have chicken again, or you're never going to be able to eat eggs again, because it's all about the timing, and it's all about chewing very thoroughly and eating very slowly and making sure that the food that you're consuming is not dry. It cannot be dry, because that's not going to be tolerated very well. Carbonated drinks can contribute to gas and bloating and discomfort or pain. So these drinks should be avoided post-operatively and possibly even for the long term. It kind of depends. I've had some people say that, once they let the bubbles kind of rise to the top and then just chill out, and this is like months after surgery, they're able to drink their, flavored sparkling water that way, but everybody's going to be a little bit different in that regard. All right, so we talked about what happens if we eat past the first sign of fullness. We could get sick. Common causes of nausea and vomiting is going to be eating too much, but also eating too fast. The temperature of your liquids can make a difference. Oftentimes, if the liquid is just ice cold and it's too cold, it can cause nausea. Room temperature is usually better tolerated, but again, I've seen the opposite, happen as well. So everybody's going to be on a completely different journey. All right, drinking too fast, eating too fast, not chewing very thoroughly, and then eating and drinking at the same time. All of those things can cause some pain or nausea. So if you feel like you are on the verge of dehydration, these are some options for rehydration. And then here are some options for constipation. All right, so this is a list of problem foods. This is a list that I've probably spoken to you if we have had a one-on-one appointment, especially the second appointment. We want to avoid these problem foods because these problem foods are going to make you feel sick after surgery, and then they're also not going to help with your weight loss journey. So to kind of simplify this, it's anything with added sugar, and then it's anything that's a high amount of unhealthy fat. So like fried foods, like real heavy meals, like heavy appetizers at restaurants, heavy meals at restaurants, anything with a lot of butter, a lot of cheese, a lot of cream sauce, anything like that is just going to be very heavy, and it's not going to go very well after surgery. So here's a list of foods that some patients do have trouble tolerating after surgery, and it doesn't have anything to do with the nutrients in these foods. It has to do with just the texture. So, the first time you try them, maybe you don't tolerate them well, and your stomach is going to be sensitive for the first 3 to 6 months after surgery, and sometimes longer. But if you chew it very thoroughly and you try it again in the future, you could have a completely different experience. So don't think that any of these foods listed on the slide have to be ruled out altogether. You will be able to have them in your diet eventually. However, rice, pasta, and doughy breads and popcorn, maybe those we could probably do without for the long term, just because they are going to be either a high amount of carbohydrates, or number two, popcorn is typically what we call a slider food, which means that you can eat a lot of it without feeling full, which just means that it's going to be more and more calories without that early feeling of fullness that the surgery can provide for you, given that you're choosing healthy meals or healthy snacks. It's all about what we're choosing to fill our stomach pouch with. All right, so what you can expect after surgery is that it's not going to be just like weight loss that just goes like this, okay? That you're probably going to lose a lot and then it's going to level off. That's going to be a plateau or a weight loss stall. Maybe you go up a little bit and then you go down a lot and then you level off, and then it's just going to go like that staircase formation for a while, probably a couple months, if not the first year after surgery, because the first year after surgery is what we call the honeymoon phase. That's the most important time because you can lose the most amount of weight in the quickest amount of time, but it's a very important time because you are creating this new lifestyle and this new mindset for yourself. All right, and here are some strategies to get past a plateau. So what I would recommend that you do if you find that you're in a plateau is revisit your habits. Go back to the basics and see where you can kind of tighten things up or focus on things a little bit more. If you feel like you're doing all the things that you can to be successful, then your last option would just be to stay positive and be consistent. Getting frustrated is not going to be helpful. Starting with negative thoughts is not going to be helpful because that could really send you backwards into old habits or even like emotional eating. All right. So if you're interested, a lot of post-op patients find that a custom meal plan is very helpful for them, especially if they're having trouble tolerating certain things or they're having trouble getting to their protein goal. I can make a plan for you. So again, all this information is going to be on my website, but I just want you to know that this option is out there and available for you. So you would go to cassandragolden.com, you would click on custom meal plans, then you would just follow the prompts to get registered. All right, I think that's it. Yes. Okay. So I hope that you guys enjoyed this fourth lifestyle class recording. My goal in making this recording was that you could go back and re-listen to things as many times as you want, because I feel like the more that we hear it, the more it becomes part of our own thought process. And remember that the Nutrition Resource Guide is always on my website, cassandragolden.com. Click on Bariatric Surgery Patients, click here, and then you'll see download the Nutrition Resource Guide. You can also go to gulfcoastbariatrics.com. You would click on patient forms. And if you scroll down a little bit, all of the forms and the documents and the stuff for the lifestyle classes, all of it is housed on that webpage. So make sure that you have all of those websites available to you because that will help you be successful. And don't forget, you have saved, hopefully, my cell phone. So you can reach out to me, you can email me, visit my website. I am here to help you, and I wish you the best of luck in this journey.